Welcome to Midlife Matters, where we celebrate women's wisdom and wit. I'm Georgian Lussier, your host, and I'm delighted to introduce today's guest, Susan Manganello, who is a nurse that's performed a variety of roles and is now working with a vaccine program. So welcome, Susan.
Well, thank you.
Delighted.
I'm glad to be here.
Delighted to have you. And you're currently working for Protein Sciences.
Yes, I am.
And a key responsibility is to coordinate a community outreach program with a mobile clinic.
My key responsibility is to get access points for vaccine programs.
Okay.
So one of those initiatives for access points is how can we serve the community, and so we developed a collaboration with the mobile clinic. But we also do on-site clinics. I talk to physicians, I talk to different people in the medical field. So it's just getting access, getting our product out to people and educating them as to what's great about our product.
All right. Well, let's talk about the flu a little bit. I think flu season's coming up.
Yes, it is.
And how does the flu differ from a bad cold? What are some of the consequences if a flu kind of gets ahead of you?
People sometimes, when you think about flu, they don't think about how serious it is, but you can have thousands of people die from the flu. It especially hits the elderly population, those that are immunocompromised, so you look at children, pregnant women, people who are diabetics, especially respiratory problems and cardiac disease. So when you wind up getting the flu, if you had a cold, it's a sneeze, it's minor aches and pains, but a flu can put you into the hospital, and you could be there for quite a while. And like I said, we have had a lot of deaths around flu. So what we try to do is educate people that you can prevent it by getting vaccinated. And you can also prevent someone else from getting it by getting vaccinated, because you can be healthy, but your grandmother or your child or your grandchildren, you can give it to them just because you're carrying it and you don't even realize it. So we talk about the herd immunity. That's how you keep those things prevented, is by getting the flu vaccine.
Someone's having some symptoms, because my understanding is even if you get vaccinated, sometimes you can still get the flu. Is that
No,
true?
that's a myth.
Okay.
And the beauty about Flu Block is it's a pure choice, so it doesn't have the virus in it. It doesn't have formaldehyde, thimerosal, doesn't have antibiotics, latex, gelatin, gluten, no egg. That's our big, how it's manufactured. So you can't really get the flu, especially if there's not a virus in it. But sometimes I think what people get when they're getting vaccinated is there's all kinds of impurities in the traditional vaccine, the way that it's made. And so you're reacting to what's in the product, not necessarily, you can't get the flu. Especially from our vaccine, because there's no virus in it. So how are you going to get the flu from that? It's proteins. It's the antigen proteins that protect you.
Are there different strains of flus?
The World Health Organization surveys every year and then tells the CDC what strains are out there. Each vaccine is made with the same strains. So there are some 3-strain vaccines, and then there's some 4 strains. So you hear the trivalent versus the quadrivalent. But everybody has to have the same strains in it. So really what we do is it's a genetic match. So we just, through an email, they just tell us what the genetic coding is, and that's how we make our vaccine. So it's the same strains that you find in all the other vaccines.
Tell us about this innovative 5-part community outreach program. That's buses involved.
Oh yeah, well
right?
this is very exciting. What we did in January, when we heard about the poor effectiveness of the vaccine, and we still had some product left over, we partnered with Hunter's Ambulance to say, hey, let's take it on the road and let's offer it to people, and we'll just give it for free. So that's what we did. So Hunter's Ambulance and Protein Science went out on the road. We would have people call us, or we'd go to the housing authorities and go to different areas where people really didn't have access to Flu Block. And we did quite well. I think we probably serviced maybe about 400 vaccines, which was a lot for that time of season, because we're in January, February, March, so it's at the tail end of the season. So we decided to continue that project and really create it and make it live. And so how can we give access and still, figure out payment and figure out all the different collaborations that we can do. So Hunter's Ambulance has a bus that they are now gutting out, and they're going to make it like a full-blown clinic. It can probably seat about 3 or 4. It's going to have a tabletop where people go in and do the paperwork. We're going to have privacy screens. The exciting part is going to have Wi-Fi, and we're actually going to have a TV screen, so we can talk about the different collaborations and different services you can get out in the community. To take care of the billing piece, Hartford Healthcare at Home has joined alliance with us, so they're helping us with the clinic. Hancock Pharmacy, so that we can service those people in the housing authorities and those that are less fortunate that, don't have appropriate insurances or are on state assistance. Also, Spanish community and doing a big Spanish outreach. So, we're being able to hit all those. So between Hunter's Ambulance, Hancock Pharmacy, and then we have Hartford Healthcare at Home, and we have a physician, Dr. Tom Knox, who has agreed to be our signing physician, and then Protein Sciences. So it's a great community collaboration that we're all in it just to give the community access to the pure choice, the great vaccine. So we're very excited about it, and we're going to take it on the road, and whoever wants to get the vaccine, here we are. Yeah, so the bus is going to be wrapped, which is really exciting. So it's going to have all those collaborations on the bus.
And the benefits to the community are, just to be clear, so people will have more ease of access because you'll be coming kind of to them, right?
Yeah.
Maybe where they live, or an organization like SCOW that they would belong to, right, would sponsor a day.
Yep.
In terms of the financial part of it,
Well, we're going to be taking insurances, which is why, we're very thankful to Hancock Pharmacy, because Hancock Pharmacy can take care of the Medicaid component. Hartford Healthcare at Home is very generous that they can't bill Medicaid, but they will offer free vaccine for those that absolutely have no insurance. So between all the collaborations, we're going to make sure that everybody gets service. We don't want to leave anybody unturned. And so it's very exciting just to be able to work with these big conglomerates, and we're all just part of a team and just out there servicing the community, and it's a really great working team.
and how did the idea originate?
There was a program that was done through a taxi service that they sent it out by app to everybody, and they offered free vaccine. And so Minot Cox, our president and CEO, said, I wonder why couldn't we do that with Hunter's Ambulance? Well, not everybody has the Hunter's app, so to get that out to community, we thought, well, let's just at least send out a press release, let people know that we're going to do this. So I sent it to David Lowell, who's the Chief Operating Officer of Hunter's, and we all worked together on, what, we'll take a bus and we'll just take you to the community. So we got the Housing Authority, and, we called it Healthy Choices, because they're doing this whole Healthy Choice campaign. So that's the name of our program, Healthy Choices Fastbacks. And so we just made it larger than life as it rolled out, where, let's take this on in September and let's really let it roll, and we can also bill insurance companies. So, we are billing through the different mechanisms as well. So that's how it started. It's just an idea where, hey, if they could do it, we could do it too. But then the vision became really big, and working together as a team.
And this taxi service, what part of the country was it in?
They did Chicago, D.C., I don't remember all the states, but some of the really big cities. Yeah.
So someone saw the example and said,
actually, it was a collaboration with Passport Health, and we partner with Passport Health to service. They use our vaccine, and so we saw it on their webpage, and there was an article about it, and so we said, wow, this is like really exciting stuff. We also did partner with that particular program, and I think we were in the Chicago area. We did about 1,000 in one. They do it just in a few hours, so it was really exciting, and we're still trying to kick around ideas on how can we reach the community so that they know that we're here. We'll go anywhere. We just want to be able to have people to have access, and the whole thing is people like convenience. And and it's exciting having the bus come and roll in, and it's just a big community effort.
And is there some thought to taking that national as an idea?
That's my thought.
Okay.
Yeah. What I'd like to do is, once we get the stats on how we did and talk about the model and how we worked it, I'd like to be able to bring it before the summit, the flu summit that they have annually, and say, look at this great project that we did. Here's the numbers that we did. Here's what we did. Here's the collaborations. That instead of working against each other, the pharmacies, the physicians, the ambulance company, let's all work together, united, and see how we can bring access to the public and give them this great service. So that is my goal, is to be able to roll it out nationally with different programs. Doesn't have to be the FastVax program, but different communities can service the same way. We're all fighting on how can we service each other with the way that the healthcare is going. This is a great way, just teams working together and not working against each other. We're not in competition, but we're trying to service people.
That's certainly a great philosophy, refreshing. And I imagine as healthcare evolves. It just seems to be changing quickly. Not everyone understands exactly where everything is headed.
Right.
That's going to be a great challenge as far as, you know, how do we modify how maybe we've worked here to now accommodate perhaps some new requirements or opportunities.
Right.
Yeah, just stay with it, and
Right.
yeah, that's exciting.
Right. It's an innovative, creative way to bring
Right.
access to the community. And we're very grateful to Hunter's Ambulance, who has invested a lot, I would say financially, taking the bus, and they're actually gutting it out and really making it a mobile clinic and being very excited about it. But it's their service to the community.
Mm-hmm.
Yeah, we're very excited.
Thank you. That's
Yeah.
great.
Yeah.
Now, you served as Vice President of the Board for the Connecticut Center for Patient Safety.
Yeah, for many years, about
for
11
about
years.
like 11 years.
Mhm.
And share with the viewers what that organization is all about.
Well, that's a fantastic organization that really advocates for patient safety, and that's how I met Minnow Cox, as I was wearing my patient safety hat. But I really feel it's important that patients have a voice. And as a nurse and having a daughter that was sick in the healthcare industry, my eyes were really open to, they may listen to me because I know what I'm talking about, but the person next to me, they didn't listen so much, and I didn't realize how widespread that was. So I really felt it important as my obligation to teach patients and family members how to have a voice and really be heard. So I stayed on that board for many, many years, teaching and advocating for patients and family members. There's a lot of tragedy, and I look at that as what can we learn by that, and let's not make the same mistake. So how can I educate healthcare providers, and that's the venue that I went in, is to educate this one little mistake that a healthcare provider did in this particular instant with my daughter was a calamity years down the road that you had no idea. So let's think about every action that we do, and so that's my piece in it. The organization does a lot for national lobbying as well as in the state. You know, everybody hears about lawsuits and caps, and they don't understand it. But my daughter just 3 months in the hospital was over $1.5 million. Now, who's going to pay for that? So you look at those things that we're not out just because we want to sue. We need to think about the longevity of how are they going to sustain now that they have this medical injury. And so that's what we really protected the patients against and the family members, is to really educate them that we're not out for vengeance, we're out for being able to care for our loved ones for the duration of their time here. So, that's what the organization really fought for, a lot of lobbying on that.
When you were instructing, what was the venue? I mean, how did you get in front of?
We were asked to do a lot of things in colleges, so I talked to a lot of APRNs that were going out in graduate studies. I talked to nursing students, so wherever you could put your face. We did a lot of education in the colleges, and just really educated them on good nursing practice. I really felt it was really important. And we all had really horrid stories about what happened to us when we were, became a victim of malpractice, and how that impacted our lives. And I think that people don't understand that it doesn't just impact the victim, it impacts every family member. And to this day, my children are still a prodigy of what happened through the years, from having to take care of a sick child. And it impacts marriages, it impacts a lot of things. So, really educate people on every little thing that we do. So a lot of people would ask us to do that, especially if you're stepping out into your nursing career. I'd love to teach right out of the gate. Learn these good practices before you walk out of nursing school. Don't get sloppy, don't get lazy.
And speaking of nursing school, you went to college in your early 30s.
Yes,
right?
I did. Mm-hmm.
And then had your 4th child while you were earning your bachelor's and getting your RN.
Yep, I went in with a baby and I came out with a baby. Not expected, but a real delight. Yes, and I always say, my daughter wants to go to nursing school, and she's in her late 20s, and her physician, who's also mine, said, hey, my mother went to school in her 50s. It is never too late to go back to school. And I'm really thankful that I did go, and I sustained it. And even with one on my lap and having a baby born during my boards, it was really worth the journey. And I'm really very excited that I was able to do that.
And what were some factors that you felt helped you in your particular situation that maybe someone else could benefit from in terms of juggling
I had strong
school?
supports, you know, and I
Okay.
think that that's always important, whether it's your husband or your friends, you know, making sure that you have your supports in place, you know, and letting the kids know that I may not be able to be there all the time, but the time that I'm there, you make a quality time. So not being able to juggle that guilt, because a lot of people feel guilty. But you do what you need to do. But I think I'm very thankful for the supports I had. Also, too, when I went to school, I had a couple day classes, but a lot of stuff was in the evening, so my husband was there, so we didn't really have a lot of juggling with babysitters, and I think that that was really important, too. You know, you really need to make sure you have some strong supports.
And then you worked in a hospital setting. You were a home care provider and a wound specialist.
Yeah, so I started out in transplant, and that was always my my first love. So and that's where I learned my acute care skills, and I feel that that's what really groomed me for the rest of my life. You know, they can get really sick very quickly, and so I really learned to be a real critical thinker. And I'm always very resourceful, so that was really helpful, because I think in all my career paths, when you go into home care, you have to be quick and think quick. You don't have the doctor or the nurse or someone else collaborating with you. It's really you and the patient, and you really have to be those eyes for them and really understand what you're seeing. So my years in the hospital really groomed me for home care. And, you know, it's not just cushy with your little bag running into a patient's home. They're sicker and sicker because they're not keeping them in the hospital. So you really have to be alert and attuned to the patient and know what you're looking at. And then I always loved wounds, so I developed...
You always loved wounds?
Wounds, yes, I always did. Especially in transplant, we saw a lot of them. And so I was really happy when Masonic Care gave me the opportunity to be the wound specialist. And I still carry that wound specialist certification. So I keep that, and I still do see patients every now and again to keep the skills going.
I would think keeping your certifications current would be perfect in almost any occupation people are in. You know, you may
Yes.
think that you've moved on to something else, but sometimes things circle around, and it's great to keep whatever you've worked so hard to earn. Would
Yeah,
you
they do.
agree with
People
that?
always ask you questions anyway, so it's
Yeah.
good to keep current. Yeah, I think it always is. You know, and it's always the thing about home care. In transplant, I was very specialized. I mean, you know, they're major organs, so you do learn a lot, but it's a very high specialized field, and that's what you're finding in hospitals. Things are very specialized. In home care, it's everything. You know, you have to do a lot of study and a lot of research. Like, I have know nothing about that. What is that? And really learn and educate. So it was a totally different venue. And then I went into corporate, and I was like, oh my goodness.
I was just getting ready to ask.
Yeah.
The transition to corporate
Yeah.
must have seemed like a little bit of a different world.
It was a really tough challenge for me to decide to take it, and I remember telling the human resource director that, oh my goodness, I mean, how are you going to keep me busy all day? And I don't stop.
Yeah.
So she said to me, see, I told you. It's a totally different ballgame, but I feel very fortunate that Minot Cox gave me the opportunity. She did see me when I was wearing my patient safety hat. You know, I was wearing my advocacy button, and so she talked about the safe vaccine, and that gave me the venue in. I did help them when they launched their first open clinic when they were doing the flu vaccine. And she saw the skill in me that maybe I didn't even know that existed, and I've been stretched beyond stretched and have learned and grown tremendously. Just even as a person in my managerial styles, you know, just in what I've learned in the course of the last couple of years has really been tremendous. And, you know, it was an opportunity that I really hemmed and hawed, and I'm very thankful that I took.
Now, this role that you're in, is it something that did not exist before you got there?
Right, yeah, yeah. She decided that, you know, hey, I want you to work for me, and so I actually remember saying, well, what can you do? And I wrote a whole long list of things I thought that I could do, and as you see it roll out and play out, I slowly but surely, yes, I've done that, yes, I've done that, and then I become a little more comfortable with it and really learning about what I'm doing. So, I mean, initially when I first started, I didn't even realize what was entailed in everything I was doing, but I've learned a lot. You know, Minot Cox is a very, very smart woman, and just in her style, I mean, she's really stretched me beyond to really think the bigger picture, and I've learned that, you know, through time working with her.
It sounds like some of the strong traits you brought with you would be certainly innovation, creativity. I would think some of the persistency with getting your education while juggling other roles and as a more mature student, having the experience you had with your own family
hmm And I think because I have the ability to communicate through my advocacy program, one of my strongest skills is networking. So it's given me the opportunity to connect. I can connect dots really well. So I can put people together, and I don't need the recognition. I just need you together so that you can work and get to the common goal. I think in everything that I've done through protein sciences, I've looked at the relationships that I've built and have grown, which have enabled me to really move forward in my position.
And the mobile clinic was an excellent example of that,
exactly.
right?
Yes, and just thinking, you know what, we need this. Who can I ask? You know what, I'm going to make a phone call. And people just want to help you because you help them. It's, and they just want to service the community, and they like the idea. So everybody just really works together. I had one woman who I brought into the team who does our PR for us and marketing. She, first meeting, she went, oh my God, this is like so much fun. Because that's what it is. It's like you're just excited to really do this, and everybody's bouncing off ideas, and it gets bigger and bigger. So it's exciting. I'm excited to see how we roll out our first clinic. Actually, we're going over to SCAL. I think it's our first clinic for United Kickoff, so we'll be excited to be there.
In later life, women also often can blossom, which it certainly seems like that's a situation you've experienced, and your instincts and skills, something I call zenith years. Sometimes we find, oh my goodness, it kind of all comes together for us as we pull our experiences and our skills and insights together. What thoughts might you have? I know you've only been in your position maybe 3 years or something. Any idea of what you might want to do in your zenith years, wherever they may be?
In terms of where I see myself kind of rolling out, doing what I'm doing now. I think earlier if I was in home care, I don't know if I'd want to be in my zenith years in home care, but this has given me an opportunity that I could see myself just making the programs grow bigger and bigger and developing that. So where I see myself now, I'm in a real comfortable shoe, and I see myself progressing with this and just becoming bigger than life with this.
So that's as far as your vista is taking
for now.
you at this
For now,
point?
yes.
Now.
Yeah, for now. I mean, there's so much you can do and that's the part that I love about working for Protein Sciences, is that you wear many hats. So it's not like I'm just doing this. There's an idea that comes up, you know what, I can do that. And then you figure out how you're going to do it. So it allows me to grow, so it's not like I'm just doing the same thing. I wear many, many hats there. And so for me, yeah, I'm real comfortable with that because I have just continued to grow and continue to learn. So, that's where I feel really comfortable. I'd like to see this be successful and then kind of, like I said, roll it out nationally. So.
And it sounds a bit like project management, startup, greenfield sort of things.
Yeah.
Right. I believe we do tend to get wiser as we age, and many people are writing about this and talking about this, and that wisdom is associated with things like emotional resiliency, knowing when to zig and when to zag. Actually, studies say that we tend to look on the sunny side of the street as we age, and that's using functional MRIs to actually, make people believers through the science end of things. And generosity, being able to cope with adversity. So all kinds of good things about aging that maybe don't get as much press. So if you could write a letter to your younger self, what might you tell yourself with all this wisdom you have now? At 25, maybe at 40?
I think the biggest thing I would tell myself is always take that chance. Take that step and take that leap and allow yourself to be stretched. And don't be afraid to move into your next journey. I think initially when I first started, always afraid to take a new job. I'm thankful that I took the job that I did, and if I look back and reflect, there's a world of opportunity. Utilize your resources, and don't be afraid to ask the person next to you. Don't be afraid to say you don't know. These are all things that, you learn as you grow. And to work together as a team. We can't stand as an island. And that teamwork is really important, that you don't need to get the pat on the back. You need to get the job done. And that's how I view myself and view life, that, we just all work together. So if I were to reflect back, I would take that opportunity and take those chances that come your way, because they may only be once in a lifetime, and you don't want to let it pass you by, and don't be afraid to take risks.
You're a great example of that.
Well, thank you.
Yeah.
We try.
Thank you so much. I'd like to end with a quote, and I chose a quote from Marie Curie. And she said, "Nothing in life is to be feared. It is only to be understood." Which I think is a great example of problem solving, and she just was so dedicated in her whole life to discovering things, so persistent. So we can end with that note of inspiration.
Well, thank you.
Thanks for coming on, and tune in to hear other fascinating women on Midlife Matter in future segments. Georgian Lussier, your host. Thank you very much.